open to, this is a chance to give your free opinion to a politician.
I'm not in the healthcare business, but I can give you.
All right, that works.
I think it's been interesting that we finally started to hear a little bit about tort reform.
Right.
And that's so, to me, so obviously important to the cost of healthcare, and we've got to do something about it. There's a lot more, this whole crowd knows more about the thing that Bob did a great job at our last foundation meeting, outlining
Right.
what was going on, but that to me is, hadn't received the attention yet that it should.
It's interesting. I've had this conversation with people in all aspects of healthcare, from people that run nursing homes to physicians and nurses, everybody, and everybody says the same thing. Admittedly, we're over testing our population because, and this is no secret to anybody in this room, because we have to. And until we address that, then there's just going to be a lot of money going out. The two common refrains I hear about if you're going to control health costs are, number one, there has to be some way to control the legal liability exposure that healthcare practitioners feel. And second, there has to be some sort of personal responsibility introduced into the system. And I think without that, I don't know how we ever control healthcare costs without those two elements. So, other thoughts or questions or insight?
Those 2 points are critically important, and I appreciate you raising those. The discussion, I guess, at the national level is really looking like we're not going to come up with some comprehensive reform package, which may or may not be the right thing. We won't go until we're past all of that. But part of what I think we do need to continue to do as a nation at all levels that influence health policy is look at the system that we have today that really was not a design system, it was one that evolved. And there are a lot of people, I look at Dr. Johnson and others, that have dedicated their life to doing absolutely the right thing and have focused on the patient and have done the right thing. But there are a lot of convoluted things that have evolved over time that pull people in different directions. And so as you move into your role, hopefully in the future, at the state level, one of the takeaways I would ask you to remember is we all of us that have a vested interest in a health care plan recognize that we can't continue doing things the way we've done in the past. And that what all of us are looking for, none of us have the magic formula, is somehow to go back and look at the behaviors that people see demonstrated and say, what are the incentives that drive those behaviors?
Right.
And rather than being critical of components or people or processes, let's go back and look at the drivers of that. And if we want to change downstream behaviors, or if we want to focus people on doing what we think is the right thing in terms of quality and cost, then let's go back up the stream and look at the financial drivers. And if we can focus on those kind of things, I think we can make some incremental progress, if not comprehensive progress.
I think you're, and again, I'm on dangerous territory because everybody in this room knows 3 times as much about healthcare as I do, but until we figure out some way to incentivize good behavior and penalize bad behavior, I don't know how anything changes. Now, actually, just in the city's healthcare plan, when we came in, one of the places where we tried to quickly rein in the cost of city government was our healthcare costs were averaging going up 13 to 15% a year for the last 4 or 5 years. We put in some incentive-based programs in terms of stopping smoking, we'll pay for regular checkups, all the things that you would say to do. And now our healthcare costs are going up about 4 or 5%. Now there's some other things that work there, but that's still a significant chunk, a significant difference, and a lot of it is just by incentivizing the right behavior. And this is the only thing in the world that we don't do that with.
I think all these things are certainly adding to the cost, and certainly Mr. Morgan's point of tort reform. There's no question that defensive medicine is a big issue of doctors, because you only have to get sued once and have a plaintiff expert say, if you'd have done this, done another CAT scan, done this and done that, this would not have happened, so that the next time you face that particular thing, you're going to do CAT scans and MRIs and every other scan you can, because I remember what happened before.
Yeah.
So you get into that and you lose some of the old basic history and physical when you sit down and talk to the patient, spend time with the patient and know the patient. So tort reform, this is really screwed up the system, but that's another story. And I know I'm talking to the choir.
Yeah.
We need to get our friends on the Democratic side, I think, to address this too. The other thing, again, in getting to the social issues we're talking about, 50% of all of our deliveries are to single mother.
Wow.
And how do we address that? Tennessee has one of the highest infant mortality rates. Shelby County is one of the highest counties in the nation. There's been a program the last couple of years that Governor Bredesen has been supportive of, one of those acronyms. TIPQ is the Tennessee Initiative for Perinatal Quality Care. And what it is trying to bring the hospitals together, use best practices, using the data of the Vermont-Oxford system, which we're a part of, trying to get other hospitals to be a part of it. So you compare hospitals and present best practices, trying to reduce prematurity. Prematurity is one of the biggest problems we have in obstetrics as far as prolonged hospital stays, morbidity, mortality, cost, the whole thing. 15% of our deliveries, almost 50% of deliveries are premature.
Wow.
So,
And what would that have been 10 years ago or 20 years ago? I mean,
I don't know. I wish I did know because.
yeah. But that's significantly different.
Yeah.
Okay.
And I think a lot of it goes back to the teenage pregnancies,
Yeah.
the single mother, lack of prenatal care, the social problems we talk about again,
Right.
overweight, obesity,
Right.
drugs, alcohol, all of those social
Right.
ills, syntaxes that we have, you know. So that, and then, of course, getting in, we can spend a lot of time, and Anita and I particularly, because we have a very much an interest in women's health, and a lot of that is preventive health. And one of the reasons we really want to show you our new imaging center, because I really think we have a state-of-the-art that is really, is not equal in many places as far as breast imaging. You know, and knowing that, of course, that's the most common malignancy in women. Prevention is the key there. And with early testing, prevention can be there. So those are all issues that we're here and we are willing to embrace your thoughts. And
Right.
hopefully, if you become governor, you will come to us and say, listen, we want to work on this particular problem. You will find us here with open arms. Any of these things, the preventive health care or preventing problems that we have. Mr. Reynolds will back you up, Scott Cotton will pay for it if we need help. So, we're here with open arms of trying to embrace any of these issues.
I appreciate it, and I mean, I think one of the secrets to leading anything, I mean, if you're governor, you're expected to be an expert soon on everything from corrections to healthcare to higher ed, and the answer is, you better bring a great team of people with you, but then you also need to have a resource group that you go to and say, all right, here's where we are as a state, what do we need, how do we attack that?